The Dilationuterus uses sure-access technology to gently gain access to the cervical canal and perform cervical dilation, even in challenging cases such as stenosis. Sure-access technology enables the flexible balloon to travel through the cervix while reducing the risk of perforation and the creation of a false passage. Fill the inflation device with 10 cc's of saline. Connect the inflation device to the dilator catheter by rotating the luer lock clockwise. Charge the device by rotating the plunger clockwise until the black pressure indicator's tip is within the green zone. Check the charged outer balloon by slightly pushing the proximal handle forward while holding the distal handle. Place the dilator tip against the cervix. Push the proximal handle until it connects with the distal handle to insert the outer balloon. Rotate the plunger clockwise to inject saline into the outer balloon. The pressure will build up until the outer balloon splits open, revealing the inner balloon. Stop rotating the plunger when the pressure indicator drops back down. Rotate the stopcock 90 degrees. To fully dilate the cervix, rotate the plunger clockwise until the pressure indicator is in the blue zone. The Dilationuterus will give you peace of mind so that you can stay focused on your patient and procedure at hand, and less on getting across the cervix.